Something you should know about the All-on-X procedure and clearing up this confusion of what is All-on-X. What does the X actually stand for? So when we're talking about All-on-X dental implant procedure, that is when we place 4 or more dental implants to support a full arch of teeth, whether it be the upper or the lower arch. So that means that we're replacing 10 to 12 teeth on the top or the bottom with a certain number of implants. So why the X? And there's a lot of confusion about that. Some people only have enough bone to support 4 dental implants. And so the procedure was made in a way where we can place 2 implants angled and 2 implants straight. And then that allows us to get to the posterior or the back area and place all the teeth that we need to replace the missing teeth. Now, sometimes 4 implants is not enough. And what determines whether you can get more implants? We always like to place 6 implants if possible. That creates a better foundation for the prosthesis and more support. Now, some people are not a candidate for 6 implants without some bone grafting. And so can you become a candidate? Most of the time, yes, on the upper arch. Sometimes on the lower arch, you cannot be a candidate. So All-on-X. When do we want to place 6 implants? It is especially important on the upper arch to place 6 implants because the bone on the upper arch is softer. So sometimes we cannot because of the anatomy and the bone loss, but many times we try to place the 6 implants. Also, if your arch is shaped in a square or a very wide arch, and that the arch is basically your anatomy of your bone, that will determine as well how many implants we need. And so there's many different factors that your doctor knows about that will determine how many implants you need. Another thing is forces. For example, if you're constantly grinding or clenching your teeth, you need more implants. Well, what if you're not a candidate for those implants? That's when we talk about staging treatment and grafting or placing things called zygomatic implants so that we can get to the very back areas and support that prosthesis. I hope this clears up the X part about All-on-X. And basically that X stands for just a multiple range of different implants. Sometimes we place 4, 5, 6, or even up to 8 in some cases.